The AGM itself is an overview of the year, so we cover quite a lot of ground. There's a few important things that we have to do, such as our financial reporting, and we often get questions about that. Are we spending or investing our money in the best way that we can to achieve the outcomes that we want to?
I think it gives us an opportunity to showcase some of the good things that we've done over the last 12 months. Two good examples I think that we can showcase is around some work we've been doing around anti-stigma, which is some work we've been doing around mental health, particularly focusing on school children. I think that's being an important showcase of area of improvement. And then the second piece of work we're going to showcase is around the work we're doing around learning disabilities, around trying to get people rehoused into the community, and a really interesting, exciting venture that we've developed locally.
Gives people the chance to come and find out what we've been doing and what we've been doing with the public money in healthcare in Northamptonshire. But also, it's really important for us because it gives us a chance to share and hear views of the people in the county.
I've come basically to be informed about the progress in the last year and basically to ask questions about the future.
It's important for the public to give their feedback about some of the things that are still concerning them, things that we would like to make some improvements for, and more importantly, how we engage with them going forward.
We got them working together, so for the same amount of money, we reduced our waiting lists by 25%, while demand grew by 40%. So it's an example of where we did it differently, and it wasn't about slash and burn with budgets.
It increases confidence for our patients that we are listening to what they want and that we can act upon it.
I think it's a great opportunity for us to talk to people about what are their concerns, what we've been doing over the past year to try and answer their concerns, and how we can plan for the future. It's not very often that we actually get that real-time feedback from patients and the public about what the CCG is doing. What really gives me a buzz about talking directly to patients and members of the public is a feeling that we can actually together make a difference to the way healthcare is delivered and commissioned in Northamptonshire.
I don't think grassroots GPs always fully understand what commissioners do. I think sometimes they see us as a faceless other who does things to them, where really commissioning should be influenced by their needs and their thoughts. It's a really good opportunity to talk to them, to find out what's going on at ground level. I know from my own personal experience as a GP what I experience, but sometimes what I see might be different to what my colleagues see. So it's a real sense check. It helps me to be sure that my perspective is the right one.
I often enjoy the AGM. It's a highlight of my year because you actually can interact with people in a way that's not like any other meeting we go to.
Well, I think it's important to know what's going on. I find in many parts of my life that people moan about things without really knowing anything about it.
Often the meetings we have are more specific around improving quality in a certain area, whereas in AGM you can get any question about anything, and we have the entire team here that can specifically answer those questions.